I'm very thankful to the FTCCI for giving me this opportunity. And it's at cancer awareness. Today I'm going to talk something different from what I've been talking regularly. When you go to a public place, we talk about what is cancer, what are the causes of cancer, how it can be prevented, and which cancers can be screened. So cancer, just like diabetes, hypertension, and cardiac disease, neurological conditions, is a lifestyle disease. We know tobacco, alcohol as primary cause of cancer in India, and then diet, viral infections, they are the second important cause, and unhealthy food, that is a very important cause. But these things are routinely talked, and we are going to discuss about them in the other panels. Today I want to talk about something different. And unfortunately, we don't want to talk these things in a public fora, but it was the elite fora, so I can go into some controversial topics. One is the mushrooming so-called cancer screening panels, which are offered by different hospitals and different diagnostic centers, which have no validity, they have no proven value. Recently, one person, not a patient, because she doesn't have any problem, she came with hundreds of pages of investigations. I asked how much it costs. She has spent 1,05,000 for the screening package at one corporate hospital. And some other values are wrong. I mean, outside the normal values. So she has been said she is having probably cancer. Get these surgeries done. But you look at her and look at the entire package, most of the tests have no validity, and the tests where there is a borderline increase, they can occur in many other conditions apart from cancer. And we reassured her, asked her to get these abnormal tests repeated after 1 month. She is very much reassured, and she came back after 1 month with those tests, which are all become normal. So this is a very unfortunate situation, because we know cancer should be detected early. If detected early, the magnitude of treatment will be less, the quality of life will be better. That is correct. But how to diagnose early? If you look at screening, we have only hardly 4 cancers amenable for routine screening. They are the breast cancer, uterine cervical cancer, oral cancer, and then colorectal cancer, and in smokers, lung cancer. These are the approved screening. There is approved screening guidelines for these cancers only. Look at all other cancers, there are no screening guidelines, because we are going to detect so many false positives, false negatives, and these false positive tests are going to create a lot of apprehension and psychological problems in those people who have these false positive reports. And then, based on these reports, they undergo very many unnecessary investigations. So this tendency is very unfortunate. This is one thing in awareness which we want to spread to the public. The second is, the PET-CT. This has become another big problem. The PET-CTs, many people are asking us, shall we get a PET-CT done as a screening test for cancer? No, absolutely no. But there are centers and doctors who are promoting this. This is another thing which we should be aware of. And comes to another important thing is the genetic testing. Which cancers can be detected early by genetic testing, or at least in which cancers genetic testing in normal people may indicate higher rate of cancer development later. There are very few again. But now we have got so many NGS panels, cancer panels, 20,000, 80,000, 1 lakh. People are getting them done. Nobody knows what is the validity of those tests. And it is causing a lot of apprehension, tension, psychological problems for those unfortunate people in whom they are positive. We have very few genetic tests which can indicate cancer may occur at a higher rate in them, the commonest being the BRCA1, BRCA2 in breast cancer. But we have so many panels. The NGS panel, we can do, thanks to the development of the artificial intelligence, we can do hundreds of genetic gene testing simultaneously at very less cost. But are they needed? Mostly they are not needed. So this is another thing happening. We see advertisements coming on TVs also, many pamphlets, get this panel done, get this panel done, get these investigations done. But unfortunately, most of them are not indicated and they cause a lot of panic if they become positive. And then in treatment also, unfortunately, most of the information is at our fingertips. That is thanks to internet. But how much information in the internet is authentic? Anybody can upload anything, whatever they want. Because what is there in the internet, we don't know because we don't go to sites. But most of the patients ask questions. They ask us after everything is fine, she's no cancer at all, cured. They'll come and ask, shall you eat this? Shall I take sugar at all? Most of the important thing is this. If you eat sugar, cancer will come back. Don't eat any sugar. That is not there, at least in our science. Similarly, so many fats. Somebody says you eat only millets, cancer will not come. There are many people coming eating millets only with a lot of health issues. And then there are issues about alternate medicines, which may work, may not work, we do not know. But we see some patients coming with complications caused by alternate medicines. So many problems are there. This is a lot of disinformation on the net. So what we tell them is you go to authentic sites. We suggest some sites, like government sites, either at US FDA or US.gov or UK NHS or Indian ICMR. Go through those sites only, don't go for anything. But if you open your phone, so many YouTube videos will come. So many experts. Somebody says don't take sugar or carbohydrate at all. The diabetes cured. Somebody says only eat millets. Somebody says you do this, that diet. These diets have been there for ages and proved to be harmful. That's why they are given up. Like Mediterranean diet was coming out, going out, but somebody in India again promoting that. So these are the basic issues. When it comes to treatment also, these things are happening. Many patients think the robotic surgery is the ultimate. That is not the case. Even the robotic surgery has to be done by a surgeon. Robot doesn't do anything. The robotic arms are moved by the surgeon by remote control. But the media, for right reasons or wrong reasons, highlights these things, like we say bone marrow transplant, as if it is cured for everything. Very few cancers can be cured by bone marrow transplant. And more importantly, you talk about CAR T-cell therapy. CAR T-cell therapy has become many patients come and call and ask, and they represent government, you give funding for CAR T-cell therapy. Hardly 1 in 1 lakh patient will be benefited by CAR T-cell therapy. And that costs today anywhere between 5 to 10 crores, 1 person. And the chance of recurrence is again 50%. So this is one thing. Another fact that is coming on immunotherapy. 2-3 years back, an article came on group of patients with large bowel cancer treated with immunotherapy. The disease completely disappeared. So everybody wants immunotherapy. All patients ask. That's why I'm talking about these things. But subsequent years, we know what is called keynote trials. All trials have shown in almost all cancers, the benefit of immunotherapy is only 2 months. If you give immunotherapy, the patient is going to live for another 2 months. For that, patient has to spend enormous money, has to be in hospital for a long time, with a lot of side effects. So this lot of disinformation, right from screening, and then there is treatment, the investigations for treatment, different treatments, it is all going on. I think we should have a standard protocol or website where we can give proper information to the people and popularize that particular website so that patients understand what is that. We don't ask them not to go to the treatment, but they should understand. Suppose I suggest one particular surgery or particular treatment, I should explain what is the surgery I'm going to do, what are the benefits, first of all, what are the alternatives to that, what are the benefits, what are the harms, what is the cost, what is the cost effectiveness, what is the risk benefit ratio. These are very important. I think the patient should be educated to ask questions. Many times patients come, sir, they don't have time, they don't answer. One particular doctor said, I am doctor, I am telling you, you undergo this. But I think that every patient has a right to ask right questions, get answers, and take a decision with an educated mind. So these are the things which we have to popularize by spreading awareness about the cancer. I hope the next two panel discussions, we can concentrate on this, we can talk on this also. Apart from our routine, what are the causes of cancer, how to prevent them and how to detect them early, that's very good. But these are also important things. I hope our panel discussions will throw some light on them. Yes. Thank you very much.